Good evening. This is Lisa Whitty Bradley. I'm a plastic and reconstructive surgeon and CEO and founder of Chicks with MDs. Thanks so much for tuning in tonight. I'm just going to start with a little intro about myself until we get some folks coming on. If you are watching, please feel free to share this video. It's essential information about open enrollment for the Affordable Care Act and the healthcare marketplace exchanges. My story: I am a board-certified plastic and reconstructive surgeon, and approximately 4.5 years into my practice, I was diagnosed with MS and basically had to assume the role of both patient and healthcare provider. And I started learning essential information, not only about my own health and my own healthcare policy, but also about a multitude of things that I was never taught about in medical school and actually in practice, such as disability, healthcare policies, my malpractice policies, how to navigate obtaining care and making sure that I got the most exceptional care, and just making sure that I cared for myself, not just as a physician, but as a mother, as a wife, as a daughter, all of that. So I've amassed a significant amount of information, and so now I utilize my time to make sure that I'm educating both patients and physicians and making sure that I'm continuing to care for myself. And by doing this social media platform and educating people in person as well as through the social media platforms that I have, it's allowed me to be able to take care of myself and also continue to serve patients and the public at large. So that's my history. I also spend a significant amount of time educating both physicians and patients about their current coverage rights and protections and how to access the rights under the Affordable Care Act. And unfortunately, most people, providers and patients, don't really know all of the coverage options and all of the things that are available. So tonight I wanted to talk about, number one, the fact that it's open enrollment season. So from November 1st through December 15th, you can obtain new health care coverage, or you can change your existing policy by going to healthcare.gov. Now, some policies, if you already have one set, or if you have an employer, you can obtain policies through them. However, even if you have an employer, you have the option of going through the healthcare exchanges at healthcare.gov and obtaining a different policy. One may have more coverage options for you, or it may be more affordable through the exchanges. So know your rights in that regard. What we're going to talk about tonight is eligibility for utilizing the healthcare marketplace exchanges. So number one, you have to be a U.S. citizen or a U.S. national. And a U.S. national is somebody from the American Samoa. And also, you need to know that if you're incarcerated, you are not eligible for the healthcare exchanges. Also, if you have Medicare, you already have coverage that's government subsidized, so you are not eligible for the marketplaces as well. In addition, there are people who are exempt from requiring health coverage, and those are U.S. citizens who are currently out of the country. If you are out of the country for a total of 330 days within a 12-month calendar, you do not have to have health care coverage, and you will not be penalized, i.e. through the individual mandate. So just know that if you're traveling extensively abroad, you may not require health coverage. However, I would speak with your insurance company, your company if you're employed, and make sure that you have coverage, because depending upon where you are abroad, you may need some supplemental insurance policy to make sure that you and your loved ones are cared for while you're out of the country. Other things to know is that if you are a U.S. territory, so that's the U.S. Virgin Islands, Guam, and also